So welcome, Lindsay and Vinny. Thank you so much for sharing your podcast with the Coronavirus Multi-Species Reading Group. You cover a lot of different topics in the podcast. I mean, kind of the issue that unites the three speakers is what it's like to be Indigenous in the Americas in the time of pandemic. I believe one speaker is Miwok, who you met at Standing Rock, and the other two are on various sides of the Amazon from Ecuador and Brazil. And reaching out, you know, the story I thought we were going to hear from the Amazon was the story of Manaus and just the crazy lack of oxygen and just mass death that is being reported in the news. So maybe if you could help us understand how the particular communities in the Amazon relate to some of these cities that we've been hearing about in the news, and yeah, talking about these different strategies for living with the pandemic. Both, it seems like some communities are very much rejecting biomedicine and saying, you know, we've got other ways of dealing with this, while others are very much looking towards you know, vaccines and other kinds of biomedical treatments and like oxygen.
Sorry, I can't actually see Vinny. Oh, there you are. I guess I'll start unless, okay. So in the podcast, I mentioned an article that Manuela Peak and Eduardo Cohn co-wrote about how there were, well, in the Ecuadorian context, there were two crises at the same time. Well, probably more than that, but they were highlighting the fact that there was an oil spill in the Ecuadorian Amazon along a major river that polluted, devastated an entire area where mostly indigenous communities were depending on that water for drinking and livelihood. And that was happening at the same time as the peak of the COVID pandemic. And what they highlighted in that article is how there are competing directions of what to do in those two emergencies. Stay at home is the COVID response. And if it's a spill, like a fire, you should get out of there. So what are we to do when there's multiple problems? And interestingly enough, oil extraction has not paused at least in Ecuador during this time. So even though communities were barred from traveling at a lot of times, the oil extraction could continue, which was exposing people to COVID. And many elders have passed away in many communities along this area. And to respond to the question about biomedicine, it's not necessary that communities are saying we have all the answers and we don't want biomedicine. But the logic in Ecuador is that by the government is that we need to extract oil in order to fund the hospitals. And something I've been doing my dissertation is tracing that history, that even in the early 70s, oil was seen as a medicine, not just for creating development and creating indicators of health, but also like you could put it on your skin and it'll get rid of bone pain, or, you know, it's just as healthy as milk if you use it in a medicinal way. And so there's always been this, well, since the beginning of the oil industry in Ecuador in the 60s, there's kind of always been this story of oil itself and the oil dollar as being beneficial to public health. So while many communities are not getting access to biomedicine and want biomedicine, they're also trying to dismantle this idea that we should always have these high-tech solutions to these problems.
Okay, so yeah, thanks for everyone who invited me to come here. It's really cool. And yeah, about what I work in a part of the Brazilian Amazon in the state of Pará, and particularly close to a city called Altamira. So to make this podcast, I talked to my friends there, some of who are indigenous, some of who are, we call them Ribeirinhos, they're Riverside people. And I also interviewed a friend of mine there who was a doctor, like a biomedical doctor, to talk about what was going there. And from these conversations, I think that, you know, in relation to this image of horrible, underprepared, avoidable death that has happened in places like Manaus, you know, yeah, it was kind of like very predictable that something like that would happen in the Amazon, because getting access to healthcare throughout most of the Amazon is a complicated thing that takes weeks to reach a hospital. So in a case of a pandemic in which time is really important, diagnosis, you know, rapid results is something that is super important to stop something like this from spreading. It was obvious that the Amazon was a place where this would not, there would be very few tools to avoid that kind of thing happening, and compiled with a lot of you know, governmental irresponsibility. The Bolsonaro government was very active in denying that this even is like a concern, sort of like parroting what Trump was doing here in the United States. From talking to the people there, the sense that you get is that the pandemic just spread like wildfire while there was really nothing that could control it. Like basically all my friends were all saying like, oh yeah, everyone got it. And another layer of that was that, you know, social distancing or social isolation, these kinds of measures that were put in place in urban places or other places, was never really also an easy thing to do in a place where communal life and being together with kins and athletes is like the central part of life, you know, that you can't just, it's not that easy to ask people to stay away from each other in that situation, or in any situation. So a lot of the conversations that I've had with people were in that sense that it just spread, and talking to healthcare workers from the side of biomedicine, it has been a very delicate balance of trying to like talk about what can be done to avoid an even quicker spread of the disease, and what is just impractical given the situation, and which to me has been a really, you know, fascinating thing to observe, talking to both sides. And speaking to Lindsay's point, I think that that's very true, that in a way, our idea of what, you know, an abstract notion of biomedicine doesn't necessarily apply, or it's not an either or kind of situation that you either use, you know, Western biomedicine or traditional medicine. People are, I think, making through their choices and actions and practices hybrids of these two things that then are being tested and seen as what fits into their daily lives and what they think, you know, works best for their situation.
I was also thinking of maybe like 3 points of reference in relation to these kind of frontline stories from the pandemic. You know, first it's kind of the histories of social abandonment that we get, you know, through Nancy Shepherd Hughes' Death Without Weeping, where, you know, the only way to count the dead babies is to go to the coffin maker who's making them out of cardboard and, you know, try to keep track of death in a way that the state's not doing. Or João Biel's account of Bare Life and Vida, you know, these these populations of people who've just kind of been abandoned and relegated to particular places by the state. But then also, recently in this reading group, we had Heather Paxson discuss her work, and she talks about microbiopolitics, and she's thinking about raw milk cheese. But I wonder if there's a way to think about the local circulation of matter and meaning in ways that disrupts dominant regimes of biopolitics that is sort of happening in these, at least sort of some of the affirmative spaces of hope that seem to be outside of biomedicine. In particular, Vinny, the doctor who was talking about her recent visits to the rivering communities where it looked like a lot of people got COVID, but it doesn't seem like anybody died. She was pointing to kind of the failings of Western biomedicine to grapple with the pandemic and the importance of other kinds of knowledges and foodways that are outside of the industrial modern system as a different kind of response.
Should I just, and then I'll pass you to you, Lindsay. I think you're right that the way that people are reacting to a lot of the challenges have kind of put in a sort of tension what comes from how it is perceived from the situation and the kind of incoming information from the outside. I mean, in a way, people, there was like this lag between the news of the pandemic and the first cases arriving. So for a long time, before like the viruses came or to the region, people try to say, just go back to your riverine communities or to your villages in the forest and don't come to the city because this virus is going to arrive here by boats or by airplanes. And the city is the space where all of the sort of, governmental apparatus is located, not only the hospitals, but it's also where you get your kind of like your stimulus checks or whatever kind of government assistance you can get. So people got cut out from the source of the virus, but also the source of the relief from the virus, and this generated this tense situation. It was like, okay, so we're safe from the virus here in our communities, but I don't know, my grandma has like a kidney stone and she's suffering and I need to like get her to somewhere where she can get treated for that. And people were being forced to make these kinds of decisions that in the end, are just impractical. Like there's this idea that people in the Amazon live in isolation has actually never been true. And it's, I think this pandemic situation is another reminder of how imbricated things are, and in a way that you can't really separate them through some sort of like abstract thinking.
Yeah, what Vinny's describing really resonates with what I see going on in Ecuador, where even if you were to, like I was saying before, go to the rainforest for sanctuary, it's still also a place of danger. And there's no way to necessarily escape that, whether you're going to the city or going to the forest. I will say about bringing up the concept of hope. One thing that's been very exciting to me in the community that I was working in, they've been fighting this major lawsuit around one of the largest oil spills or oil disasters that has ever taken place. I call it an oil disaster because it was done purposefully. It wasn't like equipment failed, but all this oil was kind of left over from the production and it was too expensive to refine. It was just left in these open pits that people are living amidst. And so the people who've been fighting in this battle to hold the corporation accountable to clean it up, they've created their own healing plan. And what's pretty remarkable about it is that they used to have these toxic tours where they would get global solidarity to show what this is all about and what needs to be done for healing. And now what they're doing, only in the last year or so, they've created a hope tour to go along with it. And that idea of hope is nothing about wishing for or waiting for some kind of future to take place or action to happen, but to actively do things in the present moment, what someone might call active hope, that you're not passively waiting for something to happen, but your hope is embedded in the action itself. And in those hope tours, they highlight community projects of forest gardens, edible forest gardens, holistic healing centers, and alternatives to the kind of biomedical framework.
Super interesting. Definitely other people, if you have questions, jump in the chat or just unmute yourself. I'm also thinking of Nestor Conclini's work on hybrid cultures or culturas híbridas, like strategies for entering and leaving modernity. We could talk about strategies for entering and leaving the modern world system alongside biomedical healing paradigms. And I think, Lindsay, your work is doing a really interesting accounting of the ways that these disruptive landscape scale size projects that are producing toxins are, they might kind of seem inevitable, but people are actively working, even as power functions predictably, to create alternative sites and active hope. I really like that idea. I see, is there a chat? Francisco, do you wanna go ahead and ask your question?
Yes, Evan, thank you. Hello everyone. As I am writing there, I paid attention to the Ecuadorian part of the podcast and the notion of chakras, which are actually very similar to milpas in the Mesoamerican context. I wanted to ask you if you think that some of the categories of multi-species ethnography could be applicable there. Also thinking about the issue of translation, because when you have been commenting on the contrast between views from Western medicine and traditional ecological knowledge or medicine, for instance, I'm not sure if you were able to actually locate terms in languages that are spoken in those areas that actually correspond or could be considered equivalent, or if there is actually a problem there, or not necessarily a problem, but actually just completely different universes of meaning for these entanglements.
I love this question. Maybe I'll email you later or send a link to the group. I have a beautiful map on the environmental health clinic that I was working at. They made a healing map, and it's so multi-species idea of health. And it has 3 different columns, one for the individual, one for the familial, and one for the society. And think of, animals, plants, everything being part of this. And for each realm, you can go from a contaminated environment to a decontaminated environment to an enriching and ultimately a celebratory environment. And so that map kind of shows that the health of all of us depends on the health of everybody else, whether we're talking about humans or non-humans. Some of the terms are certainly difficult to translate, and I can't claim that I fully understand what I'm being told half the time. But one of the biggest debates in Ecuador is over good living. And so in Spanish, typically we would say buen vivir in Ecuador.
Buen vivir, yes.
And that has been used by activist groups, but also by the government in very different ways. And so the buen vivir, as it's espoused by the government, is more about alternative development. So getting out of kinds of trade agreements with the United States, instead going with China, and still having a vision of development, but alternative development. Now, lots of activists still use the term buen vivir, but a lot of indigenous communities now are pushing for sumak kausai, which have always been related, but sometimes it helps, right, to use these different terms. And sumak kausai is sometimes translated as life in plentitude. And people are going to translate it differently. This isn't a term that you could even find in Quechua dictionaries. It's a new term that has been created through a combination of indigenous movements, environmental movements, Gaia principles. And Armando Mayalema, who is a Quechua scholar in Ecuador, he actually keeps pointing to the Minca, which I don't know if you use the term Minga in Mexico for like when you have a volunteer group basically come together in the community to do a project, whether it's to repair a road or
Tequio is a term that is commonly used in Mexico. Tequio.
Oh, very cool. Okay.
T-U-I-O.
Thank you. So Minga comes from the word Minca in Quechua, and that implies a continuous care. So often we allow problems to come, and then we just want to like go in there and have a magic bullet approach to the solution. Like with an oil spill, like, oh, let's just reduce the TPH levels of the hydrocarbon levels. Whereas the affected communities have a much more holistic view, long-term view, continuous care view.
I love this. And maybe Francisco, for folks, so I remember milpas from Mesoamerican archaeology, you know, but for folks who haven't had that background in Latin American studies, maybe talk a little bit more about what a milpa is in relation to the chakra.
A milpa is basically a multi-species community where maize is at the center, but you have also squash, beans, and a few other species, even some animal and fungal species and bacterial also, of course. That in anthropological theory, from the standpoint of archaeology also, is what justifies actually the creation of the notion of Mesoamerica, right? Because besides the domestication of maize as being such an important issue in terms of how those peoples developed in that region, archaeologically speaking, the important issue for Paul Kirchhoff was actually the management of those plants in that area that's delimited geographically as Mesoamerica. Right? So it's kind of a circular tautological way of thinking, no? where anthropologists and archaeologists were always putting an accent on this ecological presence of these entanglements and the way in which humans were relating to those species, right?
Thanks. Vinny, I've got a question back for you, related in part again to the medical doctor that that you had a dialogue with. But actually, Anne, do you want to ask your question first? I don't want to dominate this discussion here. I just noticed that you raised
go
your
ahead.
hand.
Go ahead. I can wait. I will.
Okay, so it's basically, you know, kind of building on Francisco's question. You know, how are folks understanding the virus and talking about the virus, and also, you know, the doctor you spoke with talked about sort of trying to choreograph a funeral and trying to explain what PPE is and how to use it. So how is biomedical knowledge being hybridized in these spaces? What kind of syncretic understandings of the coronavirus and the pandemic are developing in these contact zones?
Yeah, that's a really great question. From my understanding of it, which is indirect, it's from talking to the people there, since I unfortunately haven't been able to go there for more than a year. But I mean, in a way, I think that that also needs to be a bit relativized, because, you know, a place like the Amazon has pandemics more often than the rest of the world, because like things like the H1N1 pandemic there was very lethal, and that was like I don't know how many years ago, what, like 5 or 6. So like you know, I feel that in places such as New York, this is like the first pandemic in 100 years, but in a place like the Amazon, they have like a tradition of dealing with these things that is much well, like of dealing with this sort of death, which we are kind of, I guess, in places like this being reminded of after having spent a couple of generations not thinking about them, right? And so I think that there is like a way of dealing with these things that is very appropriated. It appropriates what, you know, biomedicine talks about virus and and the transmission of virus in its own way. So I don't think that, for example, I'm like there's a long tradition also of speaking about disease and as caused by spirits in the Amazon. But you don't see, for example, people translating directly the incoming of a new virus as the arrival of a new spirit. You know, that doesn't really make sense within that cosmological tradition. You kind of have both at the same time. You can talk about diseases being caused by spirits and witchcraft, and you can understand that there are viruses. These cosmologies are not necessarily contradictory or you know, denying each other in any way, but there is like an interesting work of negotiation going on in places like rituals, like burials, in which you kind of have to make space for both, because one thing is to separate them, these two kind of like logics, for better, or ontologies is probably the right word. Like you can keep them separate when you're talking about them, you know, in a situation of a medical doctor visiting the village and talking about viruses. So that kind of social situation is the ontology where the viruses exist. And then you can have a couple of days later a session of witchcraft in which you have spirits circulating, and that is the world where spirits are circulating. And you know, you can be the same person and transit between these two worlds. But in a place like a funeral, and you have these two come together, then it becomes much more delicate to negotiate them coexisting in the same spot. So Érika, my friend who I interviewed, who's the medical doctor, was talking about how to approach the issue of putting the viruses in the conversation without dislodging the spirits. It was still keeping enough space for it to be there. And I think that even then, you know, they have met with success. They have been able to prevent these burials to become super spreading events and things like that.
Let's see, is Anne Stephanie still here? Looks like she might have dropped off, but Amina, I see her hand up now.
Sure, thanks. Vinny, as you're speaking, it made me think about the ways in which the idea of a spirit or of a pathogen maybe being not antithetical to each other, and that perhaps in some ways a spirit related disease is not that I want to make it sound as if it's progress, but is it protological, is a proto-microbe, or it gives rise to the idea that, yes, the body is porous and vulnerable to powers beyond the self, and how at the same time here in the United States, there, I would say the hyper modern parts of the religious right or the evangelical church seem especially predisposed to not imagine that another creature could be could invade, even though they're children of germ theory. And so it's shifting things under my feet for me. But I'm wondering if you find that in some senses there's a humility that arises from the sorts of spirituality that you're present to, that makes it makes a person more available, more tentative and open to the idea of their vulnerabilities.
Yeah, I think that's a great way to put it. The idea of humility. One way that a lot of anthropology of the lowlands of South America have talked about the peoples of Amazonia is that they are very open towards alterity. So there's like because of the history of the region of you know, in a relatively small part of the Amazon, you have languages from 4 different family groups that you know are completely different, but everyone is kind of like there, and there's a history of engaging with that alterity in combat, in intercultural exchange, in trade. And that has made, some anthropologists argue, in a very porous place for things to be incorporated into local ways of understanding the world. So I think that they are kind of equipped with this capacity of holding thoughts that would be contradictory in other minds better than sometimes we are, I guess. I don't want to like essentialize a way of thinking, but I think it comes from a history and a tradition of intercultural exchange. And that can be helpful, like in a pragmatic way, I think, in a situation like this.
Thanks. Eben, we can't hear you.
I was muted, sorry. And Stephanie, and then Soraya.
Sorry, I had lost power. I had to fetch my power cord. Yeah, so it's a question to Vinicius. You mentioned in the beginning, you talked about it already, but I thought, is there a systematic initiative by the Brazilian government that would protect the indigenous people by saying, okay, there is a pandemic coming, something like through the FUNAI, the Fundação Nacional do Índio, for instance, where they would alert them and say, now we have to close off these remote villages because we know the wave is coming? Or are they just left to their own? I mean, you said that they are much more, they have pandemics quite frequently, but I was wondering, isn't there also something that would alert them? And also in the podcast, it was Professor Érika Pelligrino, the professor from the Universidade do Pará, who mentioned something about antibiotics and that they're easily being prescribed when you have an infection in Brazil, but then when you have the COVID, then they would not resort to the antibiotics, but rather take a natural medicine. But it could be argued that the COVID-19 is like an infection of the lungs, and so you could argue that you would take antibiotics for that as well. So why are they then given the natural or the native medicine? Is it because it's an unknown disease that they would resort to their traditional medication? Yeah, that's my question.
Okay, thanks. I'll try to, I'll start from the first one about a system of alert. So I think that there was actually, a reasonably kind of fast system of alerting everyone to stay within their villages. What didn't happen was the next step of providing these villages with the things that they needed so they wouldn't have to come to the city to get, they have, like, for example, radios that they need to communicate with the outside world to, like, know things about the pandemic. But if you have, like, a broken battery or something, like, they can't fix it by themselves there. So what they didn't have was a situation in which, there would be one designated driver who got tested that before going there to take the stuff to bring things like medicine that they needed or radio batteries or whatever, and then come back immediately after. I think that the part that the government did a terrible job was in they'll be fine by their own. They're like indigenous people, so they can like live off the land forever, not realizing that you still need to keep a channel for medicine, manufactured goods that have become essential to life in places like this. Like most people that I know there nowadays hunt with guns rather than bow and arrow, because it's so much easier and so much better like to find food with a gun. I think that was like the part where Funai really messed up. Like they should have made a plan so that they could have stayed within their villages but still had access to the things that they needed. And for the second part about the antibiotics, I don't really know very well. I can't claim to have much knowledge about medicine, but I think that what they were seeing was that the people who were going to the cities to get treatment were dying in these hospitals, even though they had access to antibiotics and respirators and all these things. So even though, it is also really the effects of antibiotics on a sick body, a body that's sick with an infection, is really incredible, right? Like you take an antibiotic and one day later you're already feeling much better. And that's why people want to take antibiotics all the time, because they associate that with feeling better. But in a situation like this, people were realizing that they were not working in that way that it works in getting children that have, an infectious diarrhea well really quickly. They realized that it was not saving the people from this disease. So they turned to things that they thought had a better chance. And it turned out to be the right choice, so to say, like to keep the sick people within the community and tending to them there, rather than sending them to overloaded hospitals in nearby cities in which people were dying at a much greater rate.
Yeah, I think that the failings of modern medicine to deal with SARS-CoV-2 are particularly apparent from the Amazon. And, in places like New York, you have monoclonal antibodies. Now, of course, antibiotics don't work for the coronavirus. Ventilators, the latest statistics suggest that it's maybe just 1 in 10 patients that are going to make it in New York City if you take them off a ventilator, and even those that come off the ventilator are likely to have cognitive impairment. So, looking at the failings of modern medicine from this particular vantage point, I think is really interesting. And it'll be also interesting to see how vaccines are rolled out in this part of the world. So Raya, you have a question about decolonizing healthcare in the US.
Yeah, there are many questions. I mean, also with respect to the vaccine, and if about the role of vaccine in the Amazon communities and so on, how that is going. But yeah, I had a question. I think it was the last intervention in the podcast, which was more about the US, I guess, right? And it was about decolonizing healthcare here. And it seemed like decolonizing really meant the community sort of taking care of themselves and with their own medicine, right? So my question there would be, but what does it mean for, decolonizing healthcare is not just in relation to specific communities, right? It's also decolonizing it in relation more generally, right? And so I would ask, so what would be the effect back on the, more general healthcare system if decolonizing, so to say, happens only in the communities and with going back to, that more traditional, newly discovered traditional approaches. So do you have, are you looking at this more closely, and or would there be the hope, because at the same time she also mentioned underfunding of the healthcare system. So that seemed, so how is it going together, and how is it working in both ways?
Right, great question. Something that I remember Desiree shared, I don't know if it was in the podcast or in a private conversation, but about access to indigenous medicines through the healthcare system. So if you go to a healthcare system on a reservation, you're, as I understand it, if you're a member of that community, you get access to certain kinds of care. But if you have to travel and go to a different clinic that is not an indigenous run clinic or has the indigenous medicines readily available, then you're being kind of pushed into a very particular kind of health program. So I think that that's part of it, is making indigenous medicines more readily available to indigenous communities, but as well as regular biomedical care, but also recognizing that there are so many levels to health that have been colonized, like even access to food. And something that really struck me in that podcast when she was talking was about the cost of food and how can people even, where they have to decide, am I going to get medicine or am I going to get food? And the way that is attached, of course, to histories of colonizing indigenous land. What else can we say about that? I guess one other thing I would say, just as a non-indigenous scholar, that I can't answer a lot of these questions or try to speak on behalf of communities, especially my research is not in the United States, elsewhere. But what can we do to learn more and educate ourselves about what's going on? And there is a movement now, and has been going on for a while, to decolonize research. And right now, so many people are worried about how will they do research during a pandemic. And there's already been a move to work with community leaders and have them do, like, recognize them as the experts, right? And outsiders kind of facilitate the translation or getting the word out, whatever we can do, and maybe see it not necessarily as a huge, it is, of course, creates all kinds of challenges that we can't necessarily travel or go and do this research ourselves, but it does also kind of force this situation that people have been pushing for even before the pandemic, to go to the community leaders themselves directly. So I'm really sorry, but it's not my expertise.
No, thank you. And what I didn't realize was that the healthcare would also, in the territories, would also mean access to traditional medicine through the healthcare system. So decolonizing the healthcare system might also just mean recognizing that there is not just one kind of medicine, right? But there are these different kinds of medicine, which of course also extends homeopathy, or I don't know, or to you know, not necessarily indigenous, but you know, like Chinese medicine and so on, you know, which is not normally you can't get through your healthcare, right? Even if they know it would help, right? In some cases, but you know, if you prefer to do yoga instead of physical therapy, but you know, you get reimbursed for physical therapy, but not for yoga, right? And so that's one meaning in where how medicine could be decolonized, accepting that there are different systems and different communities to serve, maybe.
Yeah,
that's
can I?
on point.
Oh, sorry.
Oh no, I'm just totally agreeing with what Soraya said. I'm curious what you have to say, Vinny.
Yeah, I just wanted to add a little thing that I learned from these conversations as well, and listening to Lindsay and everyone who participated in the podcast, was that in a way, I think that decolonization is very close to decentralization, in the sense that healthcare systems, and particularly in Brazil, but I assume that also in the US, they tend to be centralized in either a public healthcare system or a sort of like private system that, like you said, define the rules of what is considered acceptable medical care. And from that center, in which is the center, like an urban center where people are educated in medicine, in which you know, medicine comes from, in which all the guidelines of what counts as medicine are, it's emitted from that center into all other parts of the country. And what people seem to be clamoring for was to think of medicine as something that can, you know, appreciate what is being done in other places, in which doctors can be, don't have to go to the main city of the country to be educated in medicine, that you have doctors from these, you know, young people from these communities who want to study medicine, they can study medicine there and learn different forms of doing medicine, but also the sort of biomedicine that is really important. So I took there a lot of the critique in that sense, that nowadays our medical system is too centralized into you know, a few urban centers that have all the medical schools, all the resources, all the research, and that should be more spread out to different parts of where people are living and facing different realities, and you know, different ways, cultural ways of also engaging with the questions of medicine.
Amina, I think you had a question. Yeah, see here in your chat.
Thanks. Yes, thinking about the ways that I think your last guest spoke about that thinking of land as medicine, right? And there's a microbiopolitics in play here in the United States that certainly separates the idea of land and medicine, land from body and land as medicine in a positive way. And I'm wondering if there's been any conversations in the communities that you're working a part of that are addressing the idea of decolonizing the FDA. Early in the pandemic, I was trying to access some natural remedies that had been developed for coronaviruses 20 years ago. And in the days before things shut down, I was able to resource things. And then within a period of about 4 days, the 10 naturalists around the United States that wildcrafted these herbs were shut down, or their websites were shut down by the FDA. And so there was almost like a demonizing or an obstructing. It wasn't just not just the idea that they couldn't get access in hospitals, but that there could be punishment for communicating across the internet about the wisdom of land-based remedies.
Thanks, Amina. I immediately am thinking about something I just saw posted by a friend of mine in Canada who has an herb store, and she was writing about how her herb store was not considered an essential business, so she hasn't been allowed to stay open. And meanwhile, other places are considered essential right now. And so she pretty much was saying, I believe I'm an essential business, I'm going to stay open. And I've been taking all the precautions just like everybody else. And I believe people need access to this medicine. But that's a perfect example of what you're describing. And it's unfortunate to hear that it's so widespread and that you're coming up against that too, with the FDA in the US. So I did notice in Ecuador, I don't know much about the US context, but I do know that in Ecuador, it costs so much money to get certain labels, right? To go through that system if you want to be organic or whatever else. And so now communities are creating their own label, so they don't have to spend thousands of dollars to be recognized as this or that thing. Certainly, if they were to make certain claims that weren't authorized, yes, they could be punished for that. But because they've created their own label, it has kind of seen as a different standard. And that's one way to get around it that I see people doing.
I think Clara had a question about methodologies. Clara, did you want to say more
yeah,
about your
sure.
question?
Yeah, thanks so much for a great talk and podcast. I'm a PhD student. I'm just curious about your experiences talking to sometimes disproportionately affected communities about, the pandemic, or I'm interested in climate change research. So at one point I thought I wanted to talk to like communities in California about recent fires and things like that, but I was also cautious. I just wonder how, I mean, it's clear to me that you're talking to experts in the field, but how did you go about deciding who to talk to and how to broach the subject of, like recent traumas?
I'm not sure how accurate this is, but I think that or if it also works for Lindsay's experience, but when we did the podcast, I think it was so in the middle of it that people were very much wanting and in need of talking and processing these things, because people were like, I mean, it was all done through Skype and WhatsApp, but all of my friends down in the Amazon that I would reach out to were wanting to talk about how hard it had been and what they had taken away from it, and how they thought things should be improved. And so I don't know much about your project, but I think that I don't know if this might be helpful, that approaching people at the time in which they are in a situation and a moment that they might actually benefit from talking to people and describing their stories, and they want to like share their the tough times that they went through. That could be, good for them as well.
Yeah, the side note to that is that I had reached out to a couple friends in Ecuador months before that we even started recording the podcast, and they were just too caught up in everything. So that can also happen. We actually, when we put this out, so the American Anthropological Association was having a conference and we wanted to do something on this theme, but we kind of organized it as a fundraiser too. So I'm always kind of like thinking in the back of my head, like, how can we create greater reciprocity? And it's not easy at all. It's really, really challenging to figure that out, I found, it for different contexts. But that might be something to consider about not just telling a story, which in and of itself can be really powerful, but what other forms of reciprocity can be built into the project.
Thank you so much. It's really helpful. Thank you both.
So unfortunately, we are right at the hour. It's been a beautiful conversation with you both. Did anyone else have any final thoughts that they wanted to say or share? Otherwise, we're right there at the time to have to say farewell for this week.
Well, thank you very much for having us. It was a pleasure.
What a beautiful
Thank you
grouping.
both for coming.
Thanks, everybody.
So next week, I think we're hosting Maiwa Montenegro, who's going to be speaking on her article on what grows in a pandemic, and her work in agroecology, if my memory serves correctly. So be on the lookout for the announcement on Wednesday for that. And thanks everybody, and I'll look forward to seeing you all again soon. And thank you to Vinny and Lindsay for sharing their podcast work.
Sure. Bye.
You.
Thanks,
Bye.
everyone.
See you next time.